Alrighty, welcome to Rajavithi English for Residents, Week 4. Let's overview this PDF that's been shared with you. So we'll make it smaller and we'll take a look at what comprises this lesson. So I'm looking forward to sharing this useful information with you. We'll cover quite a few things today. So this is what it looks like. We'll do a practice exam, TOEFL, IELTS reading. And this is 10 questions. Doctor-patient, clinical, conversational English, doctor-patient dialogues, multiple choice. We'll listen to some audio that entails simulation of real doctor-patient English interviews and discussions. And then we'll take a look at this exercise, which is focused on writing and structure, grammar. We all know basically how to translate from Thai to English in a medical conversation, but it focuses on exact, precise grammar. 24 questions there. And then TOEIC, grammatical discussion related to English in clinical settings, and it pertains to the reading here. So let's get started. We'll go through this practice exam, then we'll take a look at a practice IELTS exam if we have a chance. We'll do about 30 questions. We might not be able to do that. Here's an excerpt from the book entitled English in Medicine, Cambridge University Press. Chapter 2, Taking a History. A good example of English in medicine. So let's get rolling. And to start off, we'll take a look at this. Let me modify the screen here. Okay, we'll take a look at Notebook LM. I've put in this PDF, and let's take a look at what has been created here with Google's Notebook LM tool. A lot of applications, and this is not the ideal application. Let me double check my screen. Okay. Alrighty. This is created by Notebook LM. For me, it's somewhat experimental. I simply took the PDF for today's lesson and added that to a new notebook with Notebook LM. Let's just take a look at it, and it is quite attractive and interesting. It's not overly useful. I don't know that I'll bother sharing it with you, but let us take a look at this screen. Let's take a look at this slideshow that it has created. Yeah, and I think we can see it. So it uses AI to get the gist, the essence of this PDF that I've uploaded. It'll take any information and it can do some quite interesting things with it. So here's an overview of our lesson. There's a reading about PM 2.5. And it's a good visual representation of it, I believe. Although I just made this and I haven't really spent much time with it to check it. If anyone has any or is interested in this, I can certainly share it with you. I'll see if I get a chance to share it. This is a nice slide based on a form that is included at the back end of this PDF that we will probably not have time to get into, but the exercise is basically practical clinical application or usage of English, doctor-patient still It's made some spelling errors, so AI is a work in progress. This is still pretty amazing what it did with the PDF that I put in there. And these are actual images taken from the PDF. And it just looks really nice also. Most of the script is accurate. It can and does make some mistakes. AI is getting better and better with using text. This overview is something that we'll get a chance to do, I hope. The language of the doctor, the language of the patient, not the same. System review, we'll listen to interviews. All right, we're going to translate that to English. Here's a case presentation from the book English in Medicine. And this refers to the reading passage. So let's continue. And let's take a look at our PDF that I've shared with you. All right, here we go. Let's go to the very beginning because we are looking at page 1. Based on this course, you'll see a 50-question multiple choice exam. It will look just very similar to this. This is abbreviated. It's only got 30 questions. We'll go through as much as we can. And so this is actually meant for reading. However, I'm going to read through it, and you get some natural English pronunciation here. So I think it's a valuable skill, and you certainly can read along with me in the actual exam. There will not be any sound files, etc. It'll be all about reading, and this is not essential for you all because you should have, and I'm sure you do have, high reading skills. So we're not going to spend too much time on that. TOEFL and IELTS are similar, and this is a simplistic version of what you would see in an actual TOEFL exam, but this is simplified. So let's go through this, and I'll read with you. Fine particulate matter, PM 2.5, can worsen airway inflammation and trigger shortness of breath, wheezing, asthma exacerbations, and chronic obstructive pulmonary disease flare-ups. On high PM 2.5 days, emergency departments often see more respiratory complaints, but the main difficulty is that the symptoms overlap with other dangerous conditions. A patient who is just wheezing could actually have pneumonia, pulmonary edema, or even cardiac ischemia presenting as breathlessness. To manage risk, ED teams focus on early identification of red flags such as low peripheral oxygen saturation, severe work of breathing, altered mental status, chest pain, or poor response to initial bronchodilator treatment. Many departments also adjust flow during haze-related crowding. Triage may prioritize respiratory distress, and waiting areas may use filtration devices to reduce exposure. Bedside point of care ultrasound can support rapid decisions. For example, it may help distinguish pulmonary edema from asthma by showing signs consistent with fluid overload. However, POCUS is operator dependent. Accuracy depends strongly on the clinician's skill and correct interpretation. Therefore, POCUS works best as a complement to clinical reasoning and other diagnostics, not a replacement. Discharge instructions matter as much as treatment. Patients should leave with a clear plan, correct inhaler technique, realistic exposure reduction steps, checking air quality alerts, limiting strenuous outdoor activity during peaks, and specific return precautions. Importantly, advice must fit the patient's real life. Some patients cannot avoid outdoor work, and some have poor indoor quality at home. Good ED care on PM 2.5 days combines medical management with practical counseling and safe netting. All right, let's take a look at the multiple choice questions related to this. And here's a diagram that illustrates this issue in clear, well-organized format. The main purpose of the passage is to claim PM 2.5 causes one specific new disease. B, explain how PM 2.5 affects ED patients and how ED teams respond safely. C, argue that wheezing is usually harmless. D, recommend POCUS as a replacement for all imaging. E, focus on indoor air filtration technology. Correct answer here is B. And so you may, at your own pace, continue on and select the correct answers for the rest of these other 9 questions. Take your time and do that. Then we'll review the answers in a few minutes. And I'll speed this up by answering these in just a minute. But take your time and give it your best shot. All right, let's continue taking a look at the answers. In review, question 1, B. Question 2, according to the passage, why is diagnosis challenging on high PM 2.5 days? Symptoms overlap with multiple serious conditions. 3, flare-ups, best defined as sudden worsening episodes. Which of the following is listed as a red flag? B, chest pain or altered mental status. Best title for this passage: Managing ED respiratory surges during PM 2.5 alerts. In the passage, operator dependent means POCUS accuracy depends on the clinician's skill and interpretation. Which statement is best supported by the passage? The best answer is C. ED care should include both treatment and practical counseling. 8. The passage suggests discharge advice should be realistic because B. Some patients cannot avoid outdoor exposure or have poor indoor air quality at home. 9. The word complement in paragraph 3 most closely means support. Complementary, supporting. 10. Which is the best overall summary of the passage? That'd be C. PM 2.5 days increased respiratory visits, requiring red flag screening, thoughtful diagnosis, and safe discharge planning. Part 2. The medical interview. English in the clinical setting. Best opening question for acute shortness of breath. Read these and try to answer them yourself. Question 11. Why are you breathing like that? When did the shortness of breath start, and is it getting worse? You're just anxious, right? Calm down first, then we'll talk. You always come here for this. Okay. The best answer here is B. Best way to check severity quickly. Question 12. B. Are you able to speak in full sentences or only a few words at a time? Best question to screen for infection. Have you had fever, chills, or cough with sputum? Best question to explore possible cardiac causes of breathlessness. Do you have chest tightness or chest pain? Does it worsen with exertion? (15) Have you been exposed to heavy air pollution, smoke, or dust recently? 16. Best explanation before bedside ultrasound in simple language. A. I'm going to do a scan at the bedside to help check your lungs and heart quickly. 17. Best non-judgmental smoking vaping question. All right, we want to avoid any bias or judgment, so B fits best. Do you smoke cigarettes or vape? If yes, how much and for how long? If stated like this, sometimes we must simplify it for the patient. For example, how long have you been smoking? And how much do you smoke? Uncountable. How much, not how many. Although how many could be used in reference to how many cigarettes do you smoke in a day, or how many packs do you smoke. But the better question would be how much. And it's open-ended, so the patient can answer that one. Okay, 18. Best safety net advice upon discharge. And the best answer here is C. If your breathing worsens, you have chest pain, or you feel faint, please return to the ED immediately. All right. Tie to English, translation, what's it there for? Especially for writing, I believe that you all have the ability to basically translate from Thai to English. This is a focus on the writing skills, and because you all don't get a chance to do an awful lot of writing in English, it might be a challenge to write perfectly or near perfectly in English. And this is where AI can be extremely useful, especially when used as a learning tool. It can replace a teacher. And so if anyone needs any special help on this, you may send me a message. I believe my email's been shared with you in the resources. Basically goes like this. If you're opening up a tool such as ChatGPT, you can ask it to review your writing. We've already discussed this, but I'll review it one more time. Ask it to review the writing that you've done and to detect errors in structure, grammar, spelling, punctuation first. Okay. Absolutely can be used to write, to revise and edit and improve your writing. But if used skillfully and carefully, slowly and smoothly, you can get it to teach you and identify mistakes, show why these are mistakes, and teach you how to correct these mistakes. It demands patience and time. The shortcut: review my work and revise. In certain situations, that is expedient. That is something that is absolutely useful. In other situations, especially academic situations, I teach undergraduates, so if they are using AI to write an essay for them, in most situations, it's unethical to do that. They learn nothing in an academic setting. In the real working world, we're using it. People are using AI all the time. And those of us who are native speakers of English, who are able to write at a high level still, can utilize the power of AI to check for errors, because if we're moving quickly, sometimes, anyone can make a mistake. AI can frequently find them and correct them And of course, we all know AI can make significant mistakes, so we have to be very careful to avoid putting all our trust into AI. It can be extremely useful in medicine. No, I'm not an expert on that. But medical education and AI, yeah, I've taken a look at that. And again, I don't claim to be an expert. Okay, I'm going to suggest that you do this on your own. Tie to English translation. Again, it's not. This looks very simple, but to write it perfectly, especially without these choices, it's very easy, even for the best of us, to make a few mistakes. Okay, writing perfectly in English is not all that easy for many. Let's just take a look at a few examples. 19, and I'm not going to read the Thai. I don't claim to be good at reading Thai. I could work through it, but I'm not going to do that right now. A, do you like walking upstairs? B, does your shortness of breath get worse when you walk or climb stairs? Do you always avoid stairs? Why do you walk too much? You should stop. Okay. The obvious answer here, 19, is B. 20, do you have cough and sputum today? Do you have diarrhea today? Do you have a headache today? Are you angry today? Do you feel sleepy today? I think that's pretty easy to understand. And, okay, that's a reasonable translation, I think. Not that I can read the Thai very well. 21, let's go through this. Have you eaten more spicy food recently? Have you been exposed to more PM 2.5 dust or smoke recently? Correct answer is B. All right, and you can continue and complete this on your own. Questions 22 through 24. And now, part 4, TOEIC test completion. TOEIC. Listening is a very good test of listening. It's easier than IELTS. And the first part of it is images that are quite easy, even with a fundamental understanding of English, spoken English. It's easy to score 10 out of 10 on that part, but some of the conversations that you only get a chance to listen to once are not so easy. TOEFL and IELTS are more difficult listening. But anyway, this is structure. The ED director recommends that staff wear, wore, wearing, wears, worn. Pretty simple here. The correct answer is A. The hospital installed new filters to improve indoor air. Okay, this is pretty easy too. Quality. All right, so that's an example of exam short form, 30 questions, quite similar to the actual exam that you'll see at the end of this course. Now let's move on and listen to an IELTS practice exam.
Now turns to part 2.
Part 2.
You will hear a conversation between an IELTS candidate and an IELTS administrator.
First, you have some time to look at questions 11 to 15. Now, listen carefully and answer questions 11 to 15.
Good afternoon. I'm applying for a master's program at the University of Exeter in the UK. I'm planning to register for the IELTS exam at your centre next month. I have some questions I'd like to ask you before I register, if that's okay.
Certainly. Would you be taking the academic module?
I think so, but I'll have to contact the university just to make sure.
You'll probably need the academic because most universities don't accept the general training. And anyway, the procedures to register for the exam are the same for both the general and the academic modules.
Good. My first question is whether I sit all parts of the exam on the same day. I don't live here, you see, and for me it would be more convenient to do all the papers on the same day.
Unfortunately, the speaking part is scheduled for Thursdays, and reading, writing and listening tests take place on Saturdays. We can't change the days, I'm afraid.
That's a pity. Well, never mind. What sort of documents do I need to bring in order to register?
You'll have to fill in the IELTS application form and bring an ID, a copy of your ID, and 2 passport-size photos on a white background.
Will any ID do?
We only accept original passports and national IDs.
That's good to know. Did you say that reading, writing and listening are scheduled for Saturday?
That's right.
Will I get a break in between the papers?
I'm afraid there aren't any breaks between the papers. Each paper takes an hour to complete, so it's 3 hours straight through. You'll first do listening and then reading, followed by the writing test. This is a standard requirement from Cambridge.
Before you hear the rest of the talk, you have some time to look at questions 16 to 20. Now listen and answer questions 16 to 20.
Okay, and how soon after the test can I pick up my results?
It takes 13 calendar days for the results to be processed.
Can you let me know how much it is and the form of payment?
The examination fee is $200. You can pay by credit or debit card. We also accept checks. We only accept cash as a form of payment in exceptional circumstances.
And one last question. Can I mail you the application documents?
Certainly. You can send all the documents by registered mail to our address, 47 Clover Place, New Rochelle, New York.
Could you spell New Rochelle for me, please?
Certainly. Newrochle.
Could I have the zip code as well?
Sure. Our zip code is 10806.
Thanks.
You can also email us at inquiry@examsmail.com or phone us at 325-9082.
I think that's all. Thank you very much for all the information. Bye.
You're welcome. Goodbye.
That is the end of part 2.
You now have half a minute to check your answers.
Alrighty. Let's check those answers.
Now turns to part 3.
Part 3.
Okay, before we do part 3, let's check our answers here. This is question 11. The best answer was C. Not sure which module. I think it's she needs to take. There's a few spelling errors, but this is a very useful practice exam, very similar to the actual IELTS exam. 12. On which days would the candidate like to take the exam? This individual wants to take the exam all on the same day. 13. Listening, reading, and writing tests take place on. And the correct answer is Saturday. 14. What kind of ID can the candidate not use? And you got to listen carefully because it's only given once. Okay, this is ID that's not acceptable. A library card. The options that were acceptable were driving license or a passport. 15. Candidate will do the listening, reading, and writing test without breaks. Question 16, 17, 18, 19, and 20. Correct answer 13. 17, the fee, $200. 18, spelling, new, it's 2 words, New Rochelle, Rochelle, New York, zip code 10806. And there's the email, but the phone number is 3259082. All right, let's finish this up.
Now turns to part 3.
Part 3.
You will hear Peter Walsh being interviewed for a job. Listen and choose the correct answer for each question.
First, you have some time to look at questions 21 to 25. Now, listen carefully and answer questions 21 to 25.
Joanne!
Hi, you must be Rob. Nice to meet you. So, I hear you're planning to visit Australia.
Yeah, and I really wanted to talk to you because I was thinking of spending some time in Darwin, and my sister told me you're from there.
That's right.
So, tell me about it.
Well, where shall I start? Well, Darwin's in what they call the top end, because it's right up at the northern end of Australia, and it's quite different from the rest of Australia in terms of cultural influences. In fact, it's nearer to Jakarta in Indonesia than it is to Sydney, so you get a very strong Asian influence there. That means we get lots of tourists. People from other parts of Australia are attracted by this sort of international cosmopolitan image. And as well as that, we've got the same laid-back atmosphere you get all over Australia. Probably more so, if anything, because of the climate. But what a lot of the tourists don't realize until they get there is that the city's also got a very young population. The average age is just 29, and this makes the whole place very buzzy. Some people think that there might not be that much going on as far as art, music, dancing, and so on are concerned because it's so remote. I mean, we don't really get things like theater and opera in the same way as cities down in the south, like Sydney, for example, because of the transport expenses. But in fact, what happens is that we just do it ourselves. Lots of people play music, classical as well as pop, and there are things like artist groups and writers groups and dance classes. Everyone does something. We don't just sit and watch other people.
You said it's very international.
Yeah, they say there are over 70 different nationalities in Darwin. For instance, there's been a Chinese population there for over 100 years. We've even got a Chinese temple. It was built way back in 1887, but when a very bad storm, a cyclone in fact, hit Darwin in the 1970s, it was almost completely destroyed. The only parts of the temple that survived were part of the altars and the stone lions, but after the storm, they reconstructed it using modern materials. It's still used as a religious center today, but it's open to tourists too, and it's definitely worth going to see it. Oh, and as far as getting around goes, you'll see the places that advertise bicycles for hire, but I wouldn't recommend it. A lot of the year, it's just so hot and humid. Some tourists think it'll be fine because there's not much in the way of hills and the traffic's quite light compared with some places, but believe me, you're better off with public transport. It's fine and not expensive. Or you can hire a car, but it's not really worth it.
What's the swimming like?
Well, there are some good beaches, but the trouble is that there's this nasty creature called the box jellyfish, and if it stings you, you're in bad trouble. So you have to be very careful most of the year, especially in the winter months. You can wear a lycra suit to cover your arms and legs, but I wouldn't like to risk it even so, personally. And there are the saltwater crocodiles, too. I mean, I don't want to put you off. There are protected swimming areas netted off where you'll be safe from jellyfish and crocs, or there are the public swimming pools. They're fine, of course.
Before you hear the rest of the talk, you have some time to look at questions 26 to 30. Now listen and answer questions 26 to 30.
And answer the questions.
Please sit down, Mr. Walsh. My name's Jane Swain, and I'm the personnel manager.
Hello, how do you do?
Now, this is just a short preliminary interview. I'd like to chat about your present job and what you've done up till now.
Yes, of course.
Well, could you tell me how long you've had your present position in Weston's? It is Weston's, isn't it?
Yes, that's right. I am not sure. Let's see. I left university in 2005. Is that right? Yes, 2005. Then I was unemployed for about 3 months. And then I traveled round America for a few months. So, yes, it must be about 3 years now, in fact.
Yes. And have you any particular reason for wanting to change jobs? I mean, why do you want to move?
Well, I actually like my present job and still find it interesting and stimulating. The salary's okay, so it's nothing to do with money, though you can always do with more. I suppose the thing is that I'm really very ambitious and keen to get promoted, so that's the real reason.
You say you like your job. Can you tell me what aspect you like most?
Oh, my dear, that's difficult. There are so many things. The other people are great. There's a good cooperative atmosphere. I mean, among the staff, and compared to other companies, the conditions are great. I mean, the office itself and the working conditions. And then there's the fact that they give me lots of room for initiative and let me make decisions. You know, That's what I really like most about the job.
Yes, well, we're looking for someone like that. You know, someone who isn't a clock watcher and who isn't too concerned about working fairly long hours.
Oh, I don't mind that. I'm used to it.
And what about your education? You went to Manchester University, didn't you?
Yes. After leaving school, I started a diploma course in design, but I decided to give it up and did an arts degree at university instead.
Good. And have you done any courses since?
That is the end of part 3.
You now have half a minute to check your answers.
Now turns to part 4.
Part 4.
I've asked you here just to remind you about this Friday.
Alrighty, this is a useful, enjoyable, fun way to learn English. There are many series that are interesting, and this one is all about medicine. We're talking about the series, the famous series House MD, starring Hugh Laurie, and I was thinking of creating a YouTube or a video based on this. Somebody else has done it quite well, very popular, and so this highlights many of the resources that are available to you all. And let me double check my sound. Okay. Let's go back to the beginning of this one and I'll share this with you. This is... Okay, let's go back to the beginning. Now, this woman has done a fine job. The channel
Today we're learning
is all about learning English with TV series. In this session, House MD, starring Hugh Laurie. I'm not sure how to pronounce her name, but with 11 million subscribers, this woman is doing a fine job. And that's a pretty good indicator of the value of
English with a medical TV series, House.
It's a lesion. Shouldn't we be speaking to the patient before we start diagnosing?
Is she a doctor?
No, but
Everybody lies.
Dr. House doesn't like dealing with patients.
If we don't talk to them, they can't lie to us. And we can't lie to them.
Packed with medical jargon and clever interactions, this show is both intellectually stimulating and highly entertaining.
他说他开了错药给你。
No, you gave her the wrong pills.
You speak Mandarin?
恭喜你快懂什么了。
And by the way, the word a lesion you just heard in a short clip at the very beginning means an injury, a wound, or any pathology in the body. This and other words are included in the deck of flashcards that we created for this lesson that you can also watch on the Real Life English app. Unlock this lesson for free if that's your first one and get a much better learning experience right now by clicking the link in the description below.
She has a menstrual problem. She heard that birth control pills can make her feel better.
She wants birth control pills for her PMS.
I guess.
Judging by the redness around your mom's nostrils and the tissue she's got conveniently stashed in her wristband, I'd say her problem is more likely a URI than a PMS.
URI?
Upper respiratory infection. Cold.
In the clip you just watched, you might have heard some familiar phrases like cold, respiratory infection, PMS, and birth control. Let's break it all down and learn some new words and expressions you can find helpful next time you need to see a doctor. And if you're new to this channel, you should know that every week we make lessons just like this one to help you understand your favorite movies and TV series without getting lost, without missing the jokes, and without subtitles. So if that's something you want to be able to do, subscribe and hit the bell down below not to miss any of our new lessons. Now, let's learn with the scene.
She has menstrual problems. They're really bad. The pain keeps her in bed all day. Plus, she's super depressed.
So as we can understand from the scene, the woman can't speak English. So her daughter translates from Mandarin into English. She says her mother has menstrual problems and she heard that birth control pills can make her feel better. Menstrual problems are anything related to periods, a woman's menstrual cycle, like heavy bleeding, severe pain, or irregular timing.
She said super depressed.
She heard that birth control pills can make her feel better.
Birth control pills are pills that help prevent pregnancy, but they can also be used to make periods less painful, more regular, or to help with things like PMS.
She gave Mara birth control pills.
What?
I'm gonna handle it. I am handling it.
God damn, Tully.
I know.
She wants birth control pills for her PMS.
I guess.
PMS, or premenstrual syndrome, is something women deal with before their period starts, like mood swings, fatigue, irritability, and body aches.
URI?
Upper respiratory infection. Cold.
Something doesn't add up, and after a brief examination, House concludes that the woman's problems is more likely a URI than a PMS. When something doesn't add up, it means the details don't make sense or don't match what you'd expect.
Alrighty, we're going to stop it right there, but this is just one of many, many sources for improving your English that can be fun and interactive and lively. A lot of great series in English, and this individual has done a fine job, from what I've seen, turning this into a lesson. So check it out. Learn English with Dr. House. Learn English with TV series is the name of this popular YouTube channel. And there are many. If you simply search for English learning, teaching, etc., you'll find a variety of other very successful YouTube channels that can make English, learning English, fun. Okay, some of them do address English in medicine, although most do not. But a lot of value there. All right, let's finish up with English in medicine. This is from the text, Cambridge University Press, English in Medicine, and we'll just take a brief look to finish up the end of this class. If we go to our PDF, we can see this. Let's switch over. All right, let's continue. And on our PDF, this is page 12 from the text, English in Medicine, Cambridge, Taking a History 2. This is chapter 2, asking about symptoms, an extract from an interview between a doctor and her patient. The patient, 50-year-old office worker, complaining of feeling tired, lacking energy, not being herself, As you listen, indicate whether the patient has a significant complaint or not by marking the appropriate column with a tick for each system. So listen up and select the best answers.
Taking a history 2. Tasks 1 and 2.
Now, Mrs. Brown, can you tell me, have you any trouble with your stomach or bowels?
Well, I sometimes get a bit of indigestion.
I see. And could you tell me more about that?
Well, it only comes on if I have a hot... something spicy, you know, like a curry.
I see. Well, that's quite normal, really. And what's your appetite like?
Not bad.
And any problems with your waterworks?
No, they're all right.
And are you still having your periods regularly?
No, they stopped. Must have been 5 years ago.
Any pain in the chest, any palpitation, or swelling of the ankles?
Not really, Doctor.
And what about coughs or wheezing or shortness of breath?
Only when I've got a cold.
Have you noticed any weakness or tingling in your limbs?
No. No, I can't say that I have, really.
What sort of mood have you been in recently?
I've been feeling a bit down. You know, I'm not sleeping well.
Unit 2. Tasks 5 and 6.
Alrighty. Without playing the tape again, I'll give you the answers. We went through these various systems from 1 through 6, and the only complaint that stands out is psychiatric. If you listen closely, you can feel the depression. And so this patient is feeling a bit down, okay, not feeling herself, all right, indicating a potential psychiatric issue, and the need for a general practitioner to refer this patient to a psychiatrist. All right, let's finish up with something quite useful. Alrighty, I'm going to run through some of these quickly. Match each suspected problem in the first column with a suitable question from the second column. Take a look, and since we're running out of time, I'm going to move through this quickly, and we'll do one last exercise, which I think you'll find useful. All right. 1, depression. What's the best question that a clinician would ask, and a doctor discussing symptoms and problems with the patient? The correct answer would be C. What sort of mood have you been in recently? And of course, there's a variety of different ways to ask all of these questions. 2, cardiac failure. And the best answer for the best question here would be F. Have you had any shortness of breath? For asthma, the best question would be B. Do you ever get wheezy? Prostate. Any problem with your waterworks? Waterworks is something that we would probably not use very much in American English, and it'd probably be any problem urinating, etc. And there's other ways to state that. 5, coronary thrombosis. Do you have coronary? No, the question would be A. Any pain in your chest? 6, cancer of the lung. The best answer would be E, have you ever coughed up blood? All right, let's do one last useful exercise. Now, this book is available at, I'm not sure which bookstore, but it would have to be the larger bookstores in Bangkok. It's useful. All right, let's go through this. The language of the doctor and the patient. Medical term or non-medical term. The language that the patient most commonly identifies with. Take a minute to look at these 12 terms and try to get the best answers. All right, let's go through them. 1, paresthesia. The best answer for this would be pins and needles. 2, productive cough. And again, the patient would not use these medical terms except for perhaps 1 or 2 of them. Unless, well, if they're a physician, they might know them, but it would be awkward to use. The patient would not say, I have a productive cough. They would say C. Okay, I have a cough, but I cough up phlegm or spit. 3, anesthesia. And one definition of anesthesia would be numbness. Retrosternal chest pain. The best answer would be pain behind the breastbone. In the language of the patient, sternum, breastbone. Orthopnea. 5, shortness of breath when you lie down. 6, stress incontinence. The best answer would be D, trouble holding your water. 7, dysmenorrhea. Best answer would be I, painful periods. Dyspepsia. 8, corresponds with indigestion or indigestion, 2 pronunciations. Edema, British English spelling and American English. Its spelling is generally simplified. It's O-D-E-M-A. And the correct answer for 9 is A, swelling or puffiness. Intermittent claudication, 10. And the correct answer is E, cramp in the leg muscles coming and going. Insomnia, G, sleeplessness. Dyspnea, number 12, the last one, out of breath, out of puff, breathlessness. Which of these medical terms would the patient actually use and know? I would say the best answer for that question would be insomnia. Okay, this is a word that is well known, and the patient would not be confused or have any misunderstanding when we would say as a physician, are you experiencing insomnia? But it's always good to be prepared with a backup way to explain. Anyway, that'll do it for today's 4th lesson. I want to thank you for listening, and links and resources have been shared with you. So if you're interested, take advantage of that. Review this particular PDF and video for example of the exam for this course. The major difference will be this exam is 50 questions. It's been my privilege to share this with you. A lot of resources, and I want to thank you for your participation. So, all the best. Good luck on this exam, and enjoy English in medicine. Thank you very much. Bye-bye.